and or flanges require reduction. If the flanges are overextended, use a burr of appropriate size to cut some grooves to act as depth gauges to help you reduce the flange the proper amount. If there are areas of the denture base that are impinging on the mucosa, you may have to provide relief in these areas. Or if the vertical dimension will be adversely affected by the addition of a liner, use a round burr to produce depth gauge cuts to aid in reducing the denture base. Once you've placed your depth gauges, you may want to take the denture to the lathe and reduce the borders or the palate with the lathe. It's much quicker. The Brazilian liner or tissue conditioner that we'll be using in our clinics will be Linol, but there are many other products that you can use. We use 10 cc's of powder to 4 ml of liquid. When you measure out the liquid, make sure that you get it right to the 2 ml line on the dropper. And once you squeeze that out, you'll notice that a little bit of the material ends up pooling back down at the bottom. So make sure to get all the last drops of the Linol out before you go back for your second dropper fill. You'll need 2 of these measured to the 2 ml to get your 4 ml to 10 cc's of the powder. Add the powder to the liquid, and as you mix that in, you want to make sure that you do it slowly. Introduce all the powder into the liquid first, and make sure not to use a real vigorous mixing motion. It should mostly be a soft folding in of the powder and then a stropping of the material against the side of the container. In this way you'll incorporate less bubbles into your mixture. Once you get bubbles into a mixture like this, it's very hard to get them out. When you're finished, you should have a thick mix that's something like liquid honey. Before you add the Linol to the denture, you should make sure that you've reduced any overextensions and also that you've removed a little bit of the glossy surface where you want the Linol to stick to the denture. In this way, it will have less tendency to separate from the denture. Begin by taking as much of the mixture as you can and loading it into the denture in one mass. This way you will incorporate fewer bubbles again. Then you can use your spatula and a slight vibration to move the material around inside the denture. Try to be neat and prevent getting any of the liner on the external surface of the denture. That will make it easier to control. Once you get the liner on the outside, you'll find that the denture becomes very slippery and difficult to control. Take the liner and move it up and over the peripheries of the denture. You want to make sure that you get it sealed to the outer surface of the denture so that saliva can't get in between the denture and the liner and cause an area where you don't have a good seal. If this happens, you'll find that you get bacteria and yeast in those seams, and the liner will quickly deteriorate as it becomes infected. When you're finished, you should have a liner that looks smooth and continuous and not very many bubbles. When you're finished, you can take your spatula and just make sure that that's sealed well to the surface of the denture. That's ready to be inserted into the patient's mouth. Make sure you have no excess at the very back end of the denture. Make sure if you've got any bubbles that you try and poke those out so that they're not incorporated into the denture. You can just use that with a slight tapping motion. That would be placed in the patient's mouth. Then we'd use a couple of mouth mirrors to retract the sides of the cheeks of the patient's mouth and then try and insert that without brushing it against the sides of the patient's mouth too much. You'll be doing a preclinical exercise where you take a silicone cast and you'll actually be placing a liner on a duplicated denture. This is not what we do intraorally, but this is so that you get some chance to work with the material before we get to the clinic. When you fill your denture, you want to make sure that as you load that onto the silicone cast, that you see a little bit of excess expressing out around the entire periphery. In this way, you'll make sure to have captured the entire peripheral roll. Intraorally, this won't happen. The cheeks and the lips will bring that down and blend it with the denture. It'll be much smoother and easier for you to control. If you find that as you're placing this in the patient's mouth that you have a lot of excess coming out the very back, you can use your finger sweep to practice your CPR technique to make sure you get the excess out of the patient's mouth. Similarly, you could use some cotton swab applicators intraorally. If you've got large excess in the vestibule, you can use the Q-tip to remove that. Intraorally, we would just raise the patient's lip and cheek, and if there's a large excess, we would use the cotton swab applicator to just remove as much excess as we can so that they will have less trimming when we're finished. This is particularly important in the mandibular arch in the area of the lingual frenum. Intraorally, we let the liner set for about 8 to 10 minutes. Before we let it set, we make sure that it's properly oriented. You need to make sure that the patient can lightly tap their teeth together and make sure that the occlusion is okay. You also need to make sure that the length of the incisors are not excessive. Equally as important, you need to make sure that you're not pressing down so hard that you thin out the liner material. It's important that the thickness of the lining material be at least 2 millimeters uniformly throughout the denture to make sure you get the resilience that's going to provide the comfort and some of the rest for the tissue to help improve the tissue health and also improve the fit of the denture. After 8 to 10 minutes in the patient's mouth, the liner can be removed with the denture and adjusted extraorally. You'll have to be careful. At this time, the liner will still be very sticky. And if you get your hands on it, you may find that it's sticking and pulling from the denture. So try and hold the denture from the denture teeth aspect. If you need to trim some excess, the best tool to do that at this time is a scalpel blade that's heated in a Bunsen burner or one of your torches. Make sure the blade is very hot, and then it will cut very smoothly through the material. Once the blade cools, you'll find that it sticks and it tears. You do not want to leave a ragged edge while you're doing the trimming. The goal at this point, after 8 to 10 minutes, is to just get the gross excess off and leave the periphery nice and smooth. The liner is still too soft to do extensive adjustment and polishing of the surface. At the back aspects of the denture, you don't want unsupported material left past the posterior palatal seal. If you find you're encountering resistance as you're trying to cut through the material, make sure to heat your knife again. Try not to get ragged edges where you've cut. Try to make sure that the cuts that you make are very, very smooth. The hotter your blade, the easier this will be. When you're finished your initial trimming, you should see that you'd have no excess bulk. The edges of the periphery should look the way that you want your denture to look. There should be no rough edges. The back end of the denture should finish where you wanted it. There should be no gross bubbles in the mixture that you've made. You'll now place this back in the patient's mouth, send them home, so that they can wait for the material to set a little firmer, and then return the next day to do a final trim and polish of the material. This is important, especially if the liner is going to be in there for an extended period of time. Prior to sending the patient home, make sure that you don't have any large clumps of the liner either on the occlusal surfaces or on the surface of the denture. This will make it much more comfortable for the patient. When the patient returns the next day, remove the denture and trim off any rough edges or tags and so it blends between the liner and the denture surface. There should be no rough edges. You shouldn't feel a junction between the liner and the denture surface. At this point, the denture is much firmer, and you'll find that trimming with a burr is easy. Your fingers won't stick quite as readily to the material, but you'll still have to be careful that you don't put excess pressure on it, because you can distort the material. It's a plastic material, and it will deform under pressure. When you've finished adjusting the denture, take some medium coarse pumice, place it on the edges of the liner, put your lathe on low RPM, and using a damp rag wheel, very lightly buff the surface. You should be able to get a nice polish. You don't want to be pressing hard on the liner because any pressure or heat will distort it, but you'd like to get rid of any slight imperfections or roughness that there is. You should be able to buff the material till it comes to a nice shine. And we want to do that all the way around the periphery so that it's smooth and continuous, blends with the denture. It will feel much more comfortable to the patient and it'll be much healthier for the tissue. It won't become infected as easily if it's got a nice shiny surface. These liners are only a temporary liner. They will last normally 4 to 6 weeks. It's important to let the patient know that so that they don't think that the denture is in such good condition that they can just leave the liner on there and not get a new denture. When you're finished, you should find that the surface of the denture is nice and smooth and glossy, and when you rub your finger over it, there's no roughness. Here's an example of a well-polished liner on one of our student exercises using a duplicate denture. You can see that the junction between the denture and the liner is almost imperceptible. You're looking for a nice, smooth, rounded surface. You can see there's no voids in the tissue surface of the liner. And similarly, anywhere that the denture is finished on the periphery is smooth and shiny and continuous with the denture. That's a well done exercise. Remember that the interim resilient liner or tissue conditioner is just that. It's a temporary liner. It needs to be replaced occasionally, every 4 to 6 weeks. It's not a permanent liner. You need to check to make sure it's not getting infected, and you need to make sure that the patient knows how to look after it. There are special pamphlets in our clinic to provide to the patient so that they know how to look after these liners.